Hello, my name is Robin Germany, and I'm the Chief Medical Officer at Respicardia and a board-certified cardiologist. I often get asked, what is central sleep apnea? Many people are aware of obstructive sleep apnea. It's a form of sleep apnea where you stop breathing at night. So people snore, they may gasp at night, and that affects about 10% of the adult population. Central sleep apnea is a much rarer form of sleep apnea that occurs primarily in patients that are affected by cardiovascular diseases such as heart failure or atrial fibrillation. There's a couple other forms. There can be a hereditary form and a form that occurs with pain medication, but all of them have one thing in common. Patients just stop breathing, and they can stop for quite a long period of time, often over 30 seconds and sometimes up to 2 minutes at a time. Every time they stop breathing or have shallow breathing, there's drops in oxygen levels, there's arousals from sleep, and so good quality sleep also becomes a real problem with this breathing disorder. So another question I'm often asked is, how can treating central sleep apnea make me feel better, or what does it do for me? So what could you expect then if you treat it? First, you're going to have less episodes per hour, and that's really important. That's going to improve oxygen. Secondly, then, that should equate to improved sleep, so better sleep quality, maybe perhaps more dreams, more time in REM sleep, but certainly more times in deeper sleep. The remedē system is a therapeutic option for the treatment of moderate to severe central sleep apnea in adult patients. It's a fully implantable system that allows the therapy to activate automatically at night when you go to bed and shut off automatically when you get up in the morning. The remedē system is implanted by a cardiologist that specializes in pacemaker and defibrillator placement. These physicians are typically called electrophysiologists because they are specialists in electrical conduction, both to the heart and now with neurostimulators as well. So there are 2 wires that are connected to the device. One wire is a stimulation wire that stimulates the phrenic nerve to contract the diaphragm, the big breathing muscle that's at the abdomen. So there may be a second lead placed that is for sensing, to look at respirations, and your physician will determine if it's appropriate for you to receive the second wire. These 2 leads or wires are then attached to the device itself, which contains a battery and all of the electronics that are needed to monitor your sleep and appropriately stimulate you only at the time when you're laying down in bed at night. If at some point in time during the course of the night you need to get up to go to the restroom, if you just sit up, the therapy will automatically stop and come back on when you go back to bed at night. So there's nothing that you as the patient have to do to make the therapy come on or shut off. Everything happens automatically. Many of our patients are very willing to talk to other patients about the possibility of implant. If you're interested in that, they can match you with a patient who's willing to speak with you. For more information about the remedē system, talk to your provider